we're going to be continuing on with our introduction to the urinary system. So in the last part of the lesson, we left off with beginning to look at the characteristics of urine. So again, just to review, in 24 hours, your body will produce, between 1 and almost 2 liters of urine. And urine is going to have waste products that come from metabolism or from using the energy in your food, and also any kind of substances that are not needed by your body. Again, urine has a yellow color that comes from a pigment called urochrome. And so these two first slides here were a review from where we left off last time. So characteristics of urine, continuing on with that topic. We have a list here of things that are normal to find in urine. So there is a test, and we will talk about this in more detail because we're going to be doing a lab on it called a urinalysis test. A urinalysis is a common lab test that a doctor will order. It gives a lot of good information about things, regarding a person's health. So it helps doctors to diagnose a patient very easily for certain conditions. So when that test is done, when a person's urine is tested, these 4 things we have listed here are common findings in urine. So it's normal to find sodium and potassium ions. It's normal to find our nitrogenous wastes, which include urea, uric acid, and creatinine, as well as ammonia and bicarbonate ions. Abnormal things found in urine we have listed here. So it is not normal to find glucose in urine. If it is, it could show excess sugar intake, like maybe, somebody had a lot of soda or candy or something like that before their urinalysis test, so that extra glucose is spilled out into their urine. Or it could be a sign of a condition called diabetes mellitus, which is the type of, like if you hear that somebody has type 1 or type 2 diabetes, that is what diabetes mellitus is. Those are different types of diabetes mellitus. Proteins should not be found in urine. If they are found, it could be a sign of physical exertion. So maybe somebody worked out very intensely and then had a urinalysis test. It could be a sign of pregnancy, or it could be a sign of a condition called glomerulonephritis. We will be looking at diseases related to the urinary system. That's one that we'll look at when we cover those diseases. Pus, which are signs of white blood cells and bacteria, is a sign of a UTI or a urinary tract infection. Finding red blood cells or blood in the urine or hematuria is a sign of bleeding somewhere along the urinary tract, and that could be a sign of, for example, a kidney stone. Maybe that is moving throughout the kidneys and causing some bleeding as it exits the body. Hemoglobin, again, which is found in red blood cells, should not be found. There are various causes for that. It could be a bad reaction to a transfusion. It could be due to a condition called hemolytic anemia. And then bile pigments, which bile is produced by your liver and then stored in your gallbladder to help you digest fat. If bile pigments are found in the urine, that could be a sign of liver disease, such as hepatitis. So moving along to the ureters, we've talked about the kidneys in the last lesson. The ureters are thin tubes that attach the kidney to the bladder. They're continuous with the renal pelvis, and they're going to enter the posterior side of the bladder or the back side of the bladder. They run behind the peritoneum, which lines the abdominal cavity. And along with gravity, peristalsis, which if you remember when we talked about the digestive system, we talked about peristalsis. That's wave-like muscle contractions through smooth muscle. That's going to help urine move through the ureters from the kidneys to the bladder. Moving along to the bladder, it is a smooth muscular sac. It's collapsible, so its shape is able to be changed, and its purpose is to temporarily store urine. Down here at the bottom, we have this kind of triangular region at the base of the bladder called the trigone. And there are 3 openings. We have 2 from the ureters entering the bladder. You can see one right here and one right here. And the third one is going to come from the urethra, which will leave the bladder to allow urine to exit our body. In males, right around here, around the base of the bladder, you would have the prostate gland. And we'll talk about that in a little bit when we go over the urethra. Okay. But still looking at the bladder, the wall of the bladder has 3 layers of smooth muscle. Altogether, they're called the detrusor muscle. The type of tissue is called transitional epithelium. So it's a type of epithelial tissue that allows for shape change, which is important with the bladder because as it fills or empties, it needs to be able to change its shape to accommodate that volume change inside. If the bladder is empty, the walls are thick and folded, but the bladder can expand pretty significantly without increasing the internal pressure in the bladder. But when that pressure increases, that kind of gives you that feeling of needing to urinate. A moderately full bladder is about 5 inches in length, and it can hold, if it's moderately full, about 500 milliliters of urine. That's half a liter. But your bladder is actually capable of holding twice that amount of urine, so a full liter of urine. Or if you're thinking like of a 2-liter soda bottle, like half of that full of urine would be that volume. For the urethra, that's another tube that we have. It's a thin-walled tube, and it carries urine from the bladder to the outside of the body. And again, it's going to be peristalsis that allows that urine to move through this tube, just like it moved through the ureters. The release of urine from the bladder into the urethra and then out of the body is controlled by 2 sphincters. Again, we talked about sphincters when we did the digestive system. Those are ring-like valves of smooth muscle. Or usually smooth muscle, I should say. There is an internal urethral sphincter, and that would be here up at the base where the urethra leaves the bladder. That is involuntary, and it's made of smooth muscle, so you don't really have control over the function of that muscle. The external urethral sphincter, where it would be exiting the body, the urine would leave through that to actually exit the body. That is voluntary, and it's made of skeletal muscle. So when we were all little and being potty trained and learning not to pee in our pants or a diaper or whatever, you're learning control over that muscle. There are some differences in the urethra between males and females. For females, because that's listed first, the urethra is about 3 to 4 centimeters long, or roughly an inch. 3 to 4 centimeters is a little over an inch, but it's roughly an inch in length. So we can see that right here is the urethra in a female. In a male, it's about 20 centimeters or about 8 inches long, and this would be the urethra in a male. The location for females is anterior or in front of the vaginal opening. So for a female, the vaginal opening would be right here, and it would be in front of that. For males, the urethra will travel through the prostate gland, because the prostate gland would be right around here at the base of the bladder surrounding the urethra. And then it travels through the penis to have the urine leave the body. So because of that, depending on the location in the body of the urethra, it could have one of these 3 names. Sometimes, and I mentioned this earlier, with the prostate gland, sometimes as men age, their prostates become enlarged. And because that is around the urethra, that can, if it enlarges, kind of constrict the urethra, and it makes it harder for them to be able to urinate if that happens. For females, the function of the urethra is only to carry urine. So you've got the bladder here, and urine would leave the bladder through the urethra. For males, it's going to carry urine, so it does leave the bladder right here, so the urine can leave the body. But it is also a passageway for sperm cells and semen in males. So it would also, those sperm cells and semen would leave the body through the urethra of a male as well. Being able to actually get rid of urine. Again, urine will form in the nephrons of the kidney. Okay. From the kidney, it goes into the ureters, which again, a reminder that the ureters are continuous with the renal pelvis, part of the kidney. And that will carry urine. The ureters carry urine away from the kidneys to the bladder. The bladder is, again, an expandable sac that will store urine before it's eliminated from the body. And the transitional epithelium that make up the walls of the bladder, again, allows for the bladder to expand and contract to allow it to fill with urine or allow it to contract to help release urine. The technical term or medical term for urination is called micturition. As the bladder fills, so there's like a reflex, that process or that feeling of needing to urinate will occur, even though it is under voluntary control. So that means like you can tell you're going to need to urinate, but you are able to control those muscles until you would be able to get to a bathroom. Again, the urethra would be carrying urine outside of the body during that process. And the detrusor muscle, again, that we mentioned before, that attaches to the bladder and the urethral sphincter to help control urination. If we look at some disorders of the urinary system, most of the problems with the urinary system can be solved by making sure you drink enough water. So just plain water, drinking enough throughout the day. So if we say drinking enough water, how much is enough? So a healthy adult, if we look at a healthy adult living in a temperate climate, which is where we are, where we live, the Institute of Medicine determined that the quote adequate intake for men is roughly about 3 liters of beverages a day, or about 13 cups a day. For women, it's about 2.2 liters or about 9 cups. Obviously, water would be the best beverage to drink, mainly because there's no added chemicals or sugars or anything like that. But it's also better for your urinary system to drink water. However, for example, if say you have a coffee in the morning, that does have water in it, obviously, so that adds to, or counts towards your adequate daily intake of water. So our first problem that we have that can happen with the urinary system is something called kidney stones. You may have had kidney stones before. You may know someone who has had kidney stones. But what happens with kidney stones is that the urine becomes concentrated in the kidneys, and the minerals that are being pulled out of your blood actually crystallize and stick together and make what we call kidney stones inside of your kidneys. So you can see them here. They can get very large, and they can kind of block the urine from leaving the kidney, so that's going to cause other issues. Most times, if kidney stones are small enough, they just will pass on their own. It is painful, even though they're around the size of maybe like a grain of sand. It is painful for people to pass kidney stones. There is a procedure called extracorporeal shockwave lithotripsy, which crazy long name, to just mean that they use ultrasound shock waves to break up larger kidney stones to let them be small enough to pass on their own. So that can be done. A person would need to be sedated or, go under anesthesia and have this procedure happen, and then they still are going to need to wait for those kidney stones to pass on their own. Next, we have something called cystitis. That is when bacteria enters the bladder or the kidneys. So it can be a kidney infection, it can be a bladder infection. This cystitis is more common in women because the urethra is only an inch. So it's a shorter distance for bacteria to have to enter to cause that infection in the bladder or the kidneys. Next is a UTI, or urinary tract infection. Here we have a list of symptoms, and you, again, may have had a UTI. You may know someone who's had UTIs. Some people seem to just be more prone to them than others, but it is possible for anybody to get a UTI. You would have a frequent need to urinate, so you feel quite often, even though you might have just urinated, you might feel like you need to urinate again. You might have abdominal pain, burning during urination. Your urine might be kind of cloudy or bad smelling. You may have blood in the urine. You may leak urine even though you're not in the bathroom. You may have some urine leak out of your body even though you're not trying to urinate. You can have lower back pain, fever and chills because it is an infection. You're trying to fight that off. So the fever and chills are to help, with your immune system fighting off that infection. And you might be nauseous and have a poor appetite in association with a UTI. Next we have an overactive bladder. Okay, let me move these so we can see everything here. With an overactive bladder, they're going to be kind of sudden, because the bladder is a muscular sac, there's going to be sudden muscular contractions of the bladder that will produce a very urgent feeling of having to urinate. It's more common in women, although men can also have it, and it's called something called incontinence, which is the inability to control urination. In this case, it can also be defecation. But in this case, with an overactive bladder, it would be the inability to control urination. This is when people may need to have a little help and have to wear Depends, for example. If your kidneys fail, if your kidneys stop working, okay, you need your kidneys to function in order to stay alive. But sometimes there are issues that cause people's kidneys to fail and stop working. If that happens, that means that their blood is not going to be filtered by their kidneys like it should. So these people in this condition would have to have a procedure done for them 3 times a week typically, called dialysis. So dialysis is kind of like having artificial kidneys outside of your body to clean your blood, since your body can't do it for itself anymore. And that's called hemodialysis, when you would have, usually it's called a shunt created, or a fistula created, where they actually connect an artery and a vein. Person would have 2 needles inserted into their arm, one into the artery, one into the vein, and then those through tubes are connected to this dialyzer, which is the machine that will do dialysis for them. They would have some of their blood, because obviously you can't take out all of a person's blood at a time or they would die, but some of their blood is taken out and run through this machine to clean it and then put back into their body. A little more is taken out, cleaned, put back in. So that's why it's going to take quite a while. So, roughly, and it's going to depend on what stage of kidney failure they're in. If somebody is in complete kidney failure or complete renal failure, those people actually stop producing urine at all. So they would not ever urinate if that is the case, if their kidneys are completely failed, and they would need eventually a new kidney. People can survive for years, sometimes 20 years or more on dialysis, but eventually they would need a new kidney, and they would need to do that through a kidney transplant. People are able to donate a kidney. You can be a live donor to donate a kidney, because your other kidney, kind of after you would donate a kidney, your remaining kidney grows a little bit. It increases in size to help compensate for the missing kidney. So you are able to donate a kidney to someone who needs it. And if people are sometimes worried about, what if I donate a kidney and I only have one and then mine stops working, but they actually will you'll be kind of higher on the transplant list if that's the case. Like if you had already donated a kidney to somebody else and then your remaining kidney stops working. So they do kind of try to take care of those people first. So we're going to watch this quick video. I have it linked here for us. So let's go to that real quick so you can kind of see how dialysis actually works. My mom actually is on dialysis. She needs a kidney transplant. So she has to go Monday, Wednesday, Friday for 4 hours at a time so that they can clean her blood. The dialysis also will remove the extra fluid from your blood because she is in total kidney failure, so her kidneys do not work at all. So she does not produce urine any longer, so she has to limit her fluid intake so that she doesn't have to be hooked up to the machine as long. So, because she won't have that extra fluid if she drinks too much. So let's take a look.
Kidney disease is the 8th leading cause of death in the United States. An estimated 31 million people in the United States have chronic kidney disease, also known as CKD. Patients with CKD have 2 treatment options, a kidney transplant or dialysis. However, there are more than 90,000 people on the waiting list per year for a kidney transplant, so the chances of an individual receiving a transplant are very slim. Under those circumstances, most CKD patients must receive dialysis. There are 2 types of dialysis, hemodialysis and peritoneal dialysis. But what is hemodialysis?
Hemodialysis is one kind of dialysis which usually is performed in a center. And hemo means blood, so blood dialysis. A small amount of your blood is taken out of your body at one time and put through a filter and cleaned and put back in. And that's done over and over a period of 3 to 4 hours, usually 3 times a week. In order to get the blood, you have to have a way to access the bloodstream. And the most common way that's done is something in your arm under the skin. There's something called a fistula.
And it does require placing needles into this access. 2 needles are required, one to take the blood out of the body so that it goes through the machine and through the filter, and then a needle to return the blood to the body after it's been cleansed.
With that in mind, what is peritoneal dialysis?
We have a membrane called the peritoneal membrane. It is a lining of our abdominal cavity, and fortunately we can use that peritoneal membrane as a filter.
And the peritoneal dialysis is where you have a catheter in your abdominal cavity and where you do something called an exchange, where you put some fluid in your belly, let it dwell for a little bit, and then you drain it out. And as you drain it out, that takes out all the waste products and some fluid along with it.
Well, there's 2 choices for peritoneal dialysis. There is the manual bag, in which you do an exchange 4 times a day, and then there is the night cycler method, of which when you're ready to go to bed, you hook up to the night cycler, and it does these exchanges for you automatically.
Although dialysis is not painful, patients endure these scars of needles entering their arms or abdomen as they must return for treatment at least 3 times per week. CKD significantly changes the lifestyle of those who have fallen victim to this disease. Patients must change their previous eating habits and be placed on a strict diet. Patients must also implement specific medication into their lives in order to function properly throughout their day.
So with some of those medications that we just saw in there, I'll again use the example of my mom since I know what she has to do. Unfortunately, because she has to deal with this, she has to take medication before she eats or drinks anything, called binders. So it's going to help to block some of the minerals that she is intaking in her food, because something that can happen to somebody on dialysis is that your organs can actually start to harden. So she does have to be on medication specifically to try to prevent that from happening. So that's something that people also have to deal with. She is, luckily for us, on the transplant list waiting for a kidney transplant, as there are many, many people on the transplant list for a kidney, as well as lots of other organs. But since we're talking about the urinary system, we'll talk about kidney transplants. So what actually happens is if they do kind of like it's called like a paired exchange or like a domino transplant. So if we have somebody that gets tested that is actually like a match or somebody that gets tested that's willing to donate to my mom. In this example, it could be, for anybody, but let's just say in her case, because we're hoping it happens soon, that somebody's willing to donate a kidney for her, but they are not a match. What they do is they take that information, they put that into the transplant list, and they kind of try to, like, through a domino effect, like let's say here, recipient one or donor one wants to give a kidney to recipient one, but they're not a match, they're not compatible. But let's say that donor one is a match for recipient two. So they're going to donate their kidney. This person would get it. But the person that they wanted to donate to is like, that's not a match either. What they would do is they keep kind of shuffling things around until a kidney would be a match for this original recipient, and they could actually get a kidney since they had a willing donor and they just were not a match. So when you get your license, when you get your driver's license, they do ask you at that point if you would like to be an organ donor. That is, it's a big decision, but it is something that's good, and people kind of have crazy ideas about it. Like, if you're an organ donor and you're in an accident, they're not going to save you, which they don't take time to look at your ID and see if you're a donor or not before they start working on you. So I don't know where that idea came from, but it is not true. So being an organ donor is a good thing, a selfless thing to do. Whether it would be a living donor in like a kidney transplant situation or, for something after, a person might pass away. So it's a big decision, like I said, but something definitely to think about because it can help save multiple lives. So as you finish your notes, please make sure you submit that assignment before you complete and submit your ed puzzle. If you have any questions about this lesson, please make sure you let me know.